Hello everybody, how are you all doing? If you ask me, I'm doing completely fine. Now in this video, we're gonna talk about all about COVID vaccination. Being a doctor in Washington DC, USA, I was eligible to get the first dose of COVID vaccination by January and then the second dose this month in February 2021. I want to share all the reactions or the after effects or side effects I had, and also I'm trying to compile all my other doctor friends' reactions coming from all over USA, the other states, and from India also. Yes, India is another country which already started the COVID vaccination for the healthcare providers. So I'm gonna compile their reaction. I also have a public health background. I'm an MPH, Master's in Public Health. It's a global public health, and I would like to include some of the updates from UNICEF, CDC.gov, and other parts of the public health institutions, mainly the compilation of the different questions asked all over the media to Dr. Anthony Fauci from CDC. How did he reply? And those are the questions basically asked by us, the general population, common people. And just stay tuned to the end so you get to know all these answers that he is giving all over the media. I would love to explain each and every question. If you have any, just put in the comment box. And this is a time for a small intro. So I got my second dose of the vaccine this month, and I waited at least 2 weeks just to see the after effects of the vaccination for short term and long term. So within 24 hours after taking the vaccine, I just have some mild myalgia on my the injection site on my hand, and that's it. And I didn't have any fever or any kind of muscle pain there. A mild headache was there for 6 hours. And then next day I was back to work and I had no other symptom or no other problem. Now, a couple of my friends who got their second dose, they were telling me that some of them have some mild myalgia, some of them got fever, but those are very transient, just for 5 to 6 hours after the vaccine, that's period. And then next day they're back to work. I happen to have a couple of reaction videos from my friends from other states like New York, New Jersey, and a very good friend and colleague of mine from India who got covaxine, which is a different kind of vaccine than the Moderna one that we have in USA. So I would love to compile all their reactions for you, and I want to show you one by one so you get a very broad idea what's going on internationally here in India. So here they are.
Hey there. Hey guys, my name's Alan Withall. I'm a field sales consultant for Henry Schein Dental in the New York, New Jersey market. Just wanted to give everyone a quick heads up on the vaccines. I personally got Moderna. I got my vaccines at Newark Beth Israel Hospital in New Jersey. And about exactly a month ago, I got my first vaccine. After about 24 hours, I got mild arm soreness. And then exactly a month later, I got the second vaccine, and I thought I was being a hero, and within the first 24 hours I actually felt great. Actually preemptively took some Tylenol thinking, hey, maybe that'll kick in and I'll feel better before I feel worse. I feel like maybe that worked or symptoms didn't kick in, but after 24 hours I started getting a little groggy. My head hurt a little bit, but took some Tylenol. I got my vaccine at about 2:30 p.m. yesterday, and maybe like 3 hours of grogginess and I feel great again. So I highly recommend that everyone goes and gets their vaccine. I would definitely do it all over again because now I feel free. Hope everyone's safe and well. Take care.
Dr. Chiradeep Kaur. I'm a dentist who practices in upstate New York. I have been asked recently by Dr. Roy for a brief video to narrate my experiences after I received my COVID vaccines. By the way, I have received both doses of Moderna, and after both of them, the only the side effect that I had was a brief period of soreness. I took it on my left deltoid, and a brief period of soreness. Nothing much. After the second one, there was some kind of like a mild, body aches. I don't know if that was even related to that. Maybe I thought it did, but nothing much, So I would request all of you to come forward and get vaccinated as soon as possible so that we can get rid of this stupid mask. I mean, we have to wear it all the time in our offices, but we don't want to wear it all the time in our in the stores, in public places. We want to see all the beautiful faces that you have. We want to know, and we want to know which one, all the strangers. So go ahead and get vaccinated and you'll be good. Thank you and have a nice day.
Dr. Devadeep Chakravarti. I'm an oral and maxillofacial surgeon practicing in Kolkata, India. I've had both my Covishield vaccinations, first one on the 25th of January and the second one on the 22nd of February. And they both went very uneventfully, and I had just a very mild myalgia in the injection site. Apart from that, I had no reactions, and it was a pleasant experience. Thank you very much.
Recently, US has surpassed the 500,000 COVID deaths, after a year-long battle with the pandemic. So it is now very important to get all our population properly vaccinated. When we had a question answer session with Dr. Anthony Fauci of CDC.gov, we got a couple of answers from him. The questions which were basically asked by the general population, the general questions, but I would like to give you that compilation of the question answer. So question number 1 right here is it safe for all population to get vaccinated at this point? And US also starting experimental, vaccination for the 12 plus kids with Covidvaccine, and it has been asked, is it gonna be safe for the kids to go to school at this situation because all schools are gonna open next month? So here is Dr. Anthony Fauci's reply to it. So he was saying that you do better when you know better. So we can just hope that what's going to happen with this community-wide vaccination is if we get substantial amount of population get vaccinated, then the level of infection in the community will get so low that it ultimately make it better for our children too, who can start going to school more safely. And for elderly people with underlying diseases and for all other age groups in general. Yes, so we do have fears of adverse effects. So that's another question. Question number 2 is why some people are getting adverse effects after COVID vaccination? Why don't the other people have no reaction? So if we look at the risk versus benefits of any vaccine in general, the overall benefits, long-term benefits outweighs the risk. Whenever any intervention was given for any type of new medications or new vaccine in global health history, there is always a small fraction of population with vaccine will always get a kind of adverse effect in form of allergic reactions. Almost all of those people has a history of severe allergic reaction to other form of vaccines or medications before. So recommendation now is, if you have history of allergic reaction in past, you get your vaccine in a hospital outdoor facility or hospital setting. So if there is any emergency, you can be admitted and treated immediately. Apart from allergy, there is no other significant adverse effects being reported to be directly caused by this COVID vaccine. Frankly speaking, people in general are afraid to take this new vaccine. Well, my experience was quite benign. No headache or muscle ache or fever. The injection site was sore for first 24 hours. It's very common to get some mild headaches or pain after booster shot, which is something is very common, and you can get it with any other vaccine, even like annual flu shot. So that within 24 hours you don't feel 100%, but actually everybody bounces back to normal very quickly. Here I would like to include a flyer which is recently posted by the UNICEF in Instagram, explaining for the general population what does the vaccine do, what is the pathogen, antigen and antibody. The question asked to Dr. Fauci that whether the vaccine is going to alter a person's DNA. Now, he said that this is absolutely untrue. There is nothing to afraid about. There's nothing to be afraid about that. So, being an international traveler and in a healthcare profession, I feel safe when I already got the vaccination done. I don't know how long the antibody will be in my body, which is a question of experiment actually at this stage, but still some form of protection is better than no protection. So when I was looking at the international traveling options, I saw that the most of the air flights are mandating getting a COVID test done within 72 hours of the boarding. And there are sometimes the offices are mandating the employees to get a rapid COVID test done. Now the air flights are asking for the PCR test, and the offices who are asking for the rapid test. So just not to get confused, so we asked a question to Dr. Fauci about these two different kind of tests. Which one is better, the PCR or the rapid test? Now, I got the reply from him. He is saying the PCR is the most sensitive test. It's 99% sensitive. So when it comes to the test for COVID, there are two things we have to keep in mind: sensitivity and specificity. The PCR is the most sensitive test. Sensitivity means, does it pick up all the cases that is positive, where PCR is 99% sensitive. It takes 3 to 5 days to get the result though. Whereas the rapid test is the antigen test. It is 85 to 90% sensitive, which is a kind of lack of sensitivity. Now the specificity means, do you get the right answer or you can get false positive? So yeah, rapid test has a higher chance to get a false positive or false negative. So when you're testing for COVID-19 virus, there is always a possibility that you might get a false positive or false negative with the rapid test. So it's better to get a PCR test following that rapid test, just to verify whether it is positive or negative. So rapid tests are okay to do when you get the test done frequently, like every 2 to 3 days. But if you want to know whether you are infected because you have, say, exposed to a positive patient, or you have a reason to think that you might have been infected, then you do a PCR test. I hope that clears the confusion. So the vaccination in US started by the end of December, and by February or mid-February or the end of February, US government is thinking that the vaccination might cross 3 million doses, which is a good news. Most of the elderly people who are hospital bound or in nursing homes, they are also included in that second lot of the vaccination. They already got their vaccination, and which is showing in this chart that just today I got it in Instagram by New York Times posting that the COVID-19 deaths and the cases rapidly decline in nursing homes after the vaccination started, which is a very, very good news and a positive vibe. All over the US, I think all over the world should be looking at these numbers. And please, 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 guys, go ahead and get your vaccination done and get yourself safe. Here comes another thing that I really want to discuss about, and it's an international issue. While most governments try to stockpile COVID-19 vaccines, India is the country who is giving millions of doses to its neighboring countries as a vaccine Maitri program, which is a friendship through vaccination. India sent 22.9 million doses of vaccines to 20 countries free. Among the beneficiaries are Myanmar, Bangladesh, Sri Lanka, Bhutan, Nepal. It's amazing. It's hats off to India, and I hope this thing will help us to get together as a one world. So this is the roundup for today, and I hope I answered almost all the queries we have regarding COVID vaccination. This is my reaction video after my own second dose of COVID vaccine. I tried to compile all of my colleagues' reaction video too, and that's a big shout out and thank you guys for including your reactions to this video. I really, really appreciate. And then if you guys have any other question or queries, please put it in my comment box and I will try to answer them. And please do like, subscribe, and stay tuned. Be safe, still wear the mask and maintain the social distancing 6 feet, okay? And stay safe and healthy. Thank you.